Ladies, once we go through puberty, absolutely all of us will experience vaginal discharge. But have you ever done this? This discharge is different. I wonder if this is normal. If you found yourself doing that about your vaginal discharge at one stage or another, this video is for you. In this video, I will talk about all the different types of vaginal discharges that you could possibly get. I will look into their color, their consistency, and importantly for many of us, what they actually mean. And at the end of the video, I have a bonus for all of you ladies. This type of discharge that I will talk about at the end of the video, all women must know about this discharge because it can be an early sign of cancer, which if you are aware of, you can be treated early and increase your chance of fighting that particular type of cancer. Hi ladies, welcome to Hey Doc. I'm Dr. Kady. I'm a board certified family doctor. On this channel, we talk about health topics, but in particular, we focus on women's health as well as fertility medicine. If you're new, welcome, and we hope that you will consider subscribing. Getting vaginal discharge is natural. In fact, I would argue it is an essential occurrence in maintaining the health of the vulva and vaginal area in all women. Vaginal discharge ensures that the vulva and the vagina remain moist whilst preventing infections. The way that vaginal discharge is able to prevent infection can be attributed to the slightly acidic nature of the typical vaginal discharge. This slightly acidic nature is a deterrent for germs and certain bacteria. The standard vaginal discharge will consist of a mixture of dead cells that are shed by the vaginal lining and vaginal bacteria. Yes, the vagina does contain bacteria, but these are healthy bacteria that we expect to find in the vagina. In fact, the absence of these bacteria from your vaginal flora can affect the overall health of your vagina. The normal vaginal discharge will undergo variations during the different phases of your menstrual cycle. Now, notice I said normal vaginal discharge. The question I'm hearing you ask is, Dr. Kady, what is normal vaginal discharge? What does it look like? I'm glad you asked. With normal vaginal discharge, there is a very mild and very subtle odor that is associated with it. And sometimes you may get no odor at all. Also, with this normal vaginal discharge, you have no irritation with it at all. In fact, I will go as far as saying with normal vaginal discharge, you only become aware that it is happening once you see it in your underwear. So, what should you expect normal vaginal discharge to look like in terms of color? Well, it is very often clear or with a very slight yellow tinge. Now, on to what is abnormal, which is the reason why you click this video, right? The first abnormal type of discharge we will look at is this yellowy-green type of discharge, which can be very sticky and slippery. When you see this type of discharge, ask yourself this question: am I currently being sexually active? If the answer is yes, then the following question should be, have I slept with anyone new? Or am I currently sexually involved with multiple partners? And this should be followed by you actively trying to remember if you have used a condom at all times. Are you following my gaze, ladies? If not, let me explain. The reason why these questions should be the first things that you ask yourself when you see this kind of discharge is because sexually transmitted infections are the most common cause of this kind of yellowy green, very thick, sticky type of vaginal discharge. The most common type of sexually transmitted infections, STDs, that will give you this kind of discharge are gonorrhea and trichomonas infections. I'm going to say something very controversial, but I'll explain. If you are getting this kind of discharge, it is a good thing. Yes, you heard me correctly. It's a good thing. Let me explain. Many women and men at times who are infected with these STDs do not actually know that they have these infections. The The reason why is because they do not experience any symptoms. They do not get any discharge. Therefore, they continue to fester these infections in their bodies, not knowing that they have these infections. And not only do they continue passing on these infections from one partner to the other, but also as it continues staying in the body without being treated effectively, it can lead to all sorts of complications such as infertility, chronic pelvic pain, and adhesion and distortion of the pelvic organs. So if you are getting the discharge, consider yourself as one of the lucky ones because your body is telling you that there is something wrong. Therefore, you are then able to get yourself checked out and treated. And therefore, you are spared from developing all the different complications that I mentioned earlier. So whilst we're at it, let's talk about all the different symptoms of the trichomoniasis STD infection. The first is a large amount of discharge. The discharge that you get with trichomoniasis, in addition to its color being greenish yellow, what is distinct about the discharge is that it's very copious. You get lots of it. And just to confuse you a little bit more, some patients that have trichomoniasis infection, their discharge is not actually yellowish green, but for them, their discharge is instead a thin grayish discharge. But generally speaking, if you see a greenish, yellowish type of discharge, have at the back of your mind that this could be a trichomoniasis infection. The test that your doctor will do will confirm which type of infection that you're dealing with. Another very common symptoms with trichomoniasis infection is a very strong foul odor that you can perceive from your vulval vaginal area. The vulval area can be red, it can give a burning sensation, as well as slightly itchy at times. Passing urine may be painful, and you may develop a dull lower abdominal pain. So those are the symptoms of trichomoniasis. The symptoms of gonorrhea, in addition to this greenish, yellowish, thick discharge, you can also have pain whilst passing urine, pain whilst having sex, chronic pelvic pain, long-term dull pain in your lower abdominal area. And if this infection has remained untreated for a long period of time, you can also start to experience bleeding in between your periods. Now, let's go back to that original question you asked yourself when you saw that discharge. So for those of you who will say, no, I'm not currently sexually active, or yes, I've been sexually active in the past, but that's not currently happening, I'm not currently having sex, and I've had a recent sexual health screen since my last partner and everything has come back as normal. I don't have an STD. The results have shown I don't have an STD and I have not been sexually active since then. Or you are someone who has never been sexually active. So for you ladies, an STD is not going to be the reason why you're getting this greenish yellowy discharge in your underwear. So if you fall within this category of women who is not currently sexually active, but you're getting this kind of discharge, for you, the reason for this kind of discharge is something that you are consuming, something that you are putting into your body. Some of the foods that we consume have colorants, or the natural color of these foods can affect the color of our vaginal discharge. Some of the things that we consume that can affect the color of our vaginal discharge include vitamins, minerals, nutrients, and sometimes certain fruits and vegetables. Okay, I'm sure you're now thinking, okay, I know what is now possibly causing me to have this discharge. What should I do about it? Let's start with the easier cases. Ladies, if you know that you're not currently sexually active and you can think about something that you are ingesting that may affect the color of the discharge that you're getting, it goes without saying, stop taking that vitamin, stop eating that fruit, that vegetable, or those nutrient additives that you put in your smoothies, and wait a while and see if the color of your discharge reverts back to normal. If it does, then there's your answer. You then have to decide if whatever it is that you are ingesting that was affecting the color of your discharge is worth you continuing. I'll leave that decision up to you. But one thing I will say, for the women who are not sexually active, but have been sexually active in the past, make sure you are doing a sexual health screen to ensure that you are not overlooking a possible STD by just saying, oh, I've not been sexually active in a while, so it can't be an STD. You can only be sure that this kind of discharge is not caused by an STD if you've done a thorough STD screen. Only then can you attribute it to some of the other causes I've spoken about. Remember that. And for those of you who are sexually active, this kind of discharge is your cue for you to attend a sexual health clinic. As you discuss with your doctor and you request a full sexual health screen, be sure to ask your doctor as part of your STD screen to include the screening for trichomoniasis infection. This is because the screening for this STD can often be missed. Remember, the only way to test for trichomoniasis infections properly is to do a high vaginal swab. Trichomoniasis infections are treated with an antibiotic called metronidazole. It's usually at a dose of 400 milligrams taken twice a day. Now, the key is when you are being treated for this infection is for both you and your partner to be treated simultaneously. And whilst you are being treated, for you both to abstain from having sex. Gonorrhea is treated with 2 different antibiotics. The first is with an injection with an antibiotic called cefuroxime. This will then be followed by a 7-day course of an oral antibiotic known as doxycycline. Now, remember guys, this is for your information and for your education alone. I am a doctor, but I'm not your doctor. So make sure that all the advice that you hear on this video, you are taking to your doctor and you are adhering to the recommendations made by your own doctor. The next type of discharge we will look at is this pasty, clumpy, and white looking type of discharge. The most common cause of this type of discharge is vaginal thrush. Some people have described the discharge that you experience when you have vaginal thrush as cottage cheese, a type of texture. And I think that that's a very accurate description of the discharge that you see when you have vaginal thrush. Don't you agree? No? Oh, okay. Maybe it's just me then. Vaginal thrush is a very common fungal infection that can affect your vulva and your vagina. It happens because there is an overgrowth of the fungus called Candida. Now, there are various different species of the fungus called Candida. The species that causes vaginal thrush is called Candida albicans. Candida occurs in the vaginal flora as normal. The only time it becomes a problem is when there is an imbalance in the amount of Candida that is found in the vaginal flora. So normally you only get a small amount of Candida in the vagina. But under certain circumstances, for example, when you have just completed a course of antibiotics, when you have just had a period, or some people after sex. So these occurrences change the pH in your vagina, and the Candida are opportunistic. So as soon as this imbalance happens, they overgrow, and then there is more of the Candida causing the itching and the type of clumpy cottage cheese discharge that you see happening when there is vaginal thrush. Another symptom that is very common with vaginal thrush is the itching that tends to happen. So itching can be very intense, and the itching can lead to the swelling and the redness of the vulva and around the entrance of the vagina. Sometimes the itching is so intense that it can lead to very small cuts around the vulval area and at the very entrance of the vagina. And so obviously if there's small cuts in those areas, if you're passing urine, it's going to sting. So you're going to be experiencing pain as the urine touches those areas where there's a very small cuts. What do you do about vaginal thrush? Okay, the treatment varies from pessary to cream to oral tablets. Just before I move on from a pessary, let me just clarify that a pessary is to be inserted into the vagina, never consumed orally. Okay, so when your doctor prescribes your treatment for your vaginal thrush, always make sure that you look at the box that you're given at the pharmacy. If it says pessary, it is to be put in your vagina, not in your mouth. The most common drug to treat vaginal thrush is clotrimazole. And if you're given a pessary, depending on the strength of the pessary, how often you'll be inserting the pessary in your vagina will depend on the strength of the tablet. But remember I mentioned that you can also treat vaginal thrush with an oral tablet. Remember that? Yes. So for the oral formulation, the only drug to treat vaginal thrush orally is known as fluconazole. And often all it is a one-off tablet, and the symptoms will tend to subside after 2 or 3 days of taking the oral formulation. Then there is clotrimazole cream. The frequency at which you should be applying the cream will also depend on the strength of the cream that your doctor has prescribed. So, moral of the story, speak to your own doctor. On to the next type of discharge. This is the pinkish, reddish toned type of discharge that you see in your underwear that is very often small in terms of the amount of it that you will see in your underwear. Ladies, common things are common. Seeing this kind of pinkish discharge, especially for those of us who have regular periods, close to the time when you are expecting your period and you notice that the natural course of things is a couple of hours later, the color gets deeper and deeper, gets deeper red, and then you are getting more of this deeper red type of blood in your underwear, or at this stage on your pad and on your tampon. There are no price for guessing that this type of pinkish discharge was to indicate the start of your period. However, if you are getting this type of small amount of pinkish, slightly reddish tone type of discharge after sex, medically this is known as postcoital bleeding. Now, let me delve deeper into postcoital bleeding and seeing this type of pinkish, reddish discharge after sex in your underwear or on your panty liner. Unless you can attest that there was a lot of friction during intercourse, i.e. that sex was rough, or you are a postmenopausal woman who before or during the act of sexual intercourse, you weren't particularly aroused, or you felt that you weren't moist enough. There wasn't enough moisture on the mucous membrane of your vagina. In other words, you were dry. And sometimes when that's the case, sex can be quite uncomfortable. Unless those two scenarios are true for you, any kind of bleeding or seeing that kind of pinkish discharge in your underwear after sex is what we call medically as a red flag. Why? Because in the first scenario, if sex is rough, it's likely that it's caused small cuts in the mucous membrane of your vagina, and therefore those small cuts will bleed. And in the second scenario, if you are a postmenopausal woman, not only are you likely to be dry in your mucous membranes, but also the mucous membranes and the membranes lining the vagina and the vulval area as a woman gets older are thinner. So friction from the penis, again, is likely to cause cuts. And naturally, if those areas bleed under those two circumstances, it's expected. And you just need to give those parts of your body time to heal, and that will be the end of that. If those two scenarios are not true for you, I cannot stress enough, ladies, how important presenting to your doctor if you notice bleeding after sex, particularly if it happens repeatedly, or even if it happens on and off. So say, for example, it happens today, and then it's not an issue until maybe 2-3 weeks later, a month later, and then you get a break, and then it happens again. Don't just put it down to just a normal occurrence, a one-off occurrence, but seek the clinical opinion of your doctor as a matter of urgency. Now, this part is the important piece of information I promised you at the very start of the video. Bleeding after sex can be early signs of vaginal cancer or early precancerous cells that may be found in the vagina. It can also be a sign of cancer of the cervix, and at times it can be seen at the early onset of cancer found in the lining of the womb. So do not ever take seeing this kind of pinkish or even bloody discharge after sex lightly. Now, this discharge does not always mean cancer. You can see this type of discharge with inflammation of the vagina known as vaginitis, which tends to be seen when there has been long-term infection of the vaginal lining. It's also seen with cervical ectropion. In this condition, the inner lining of the cervix protrudes through the cervical opening and grows on the part of the cervix that is adjacent to the vagina. This bloody pinkish discharge that happens after sex is also common when there are cervical polyps. These are small non-cancerous growth that happen on the cervix. It tends to be common in younger women in their teens and in their 20s. And finally, it is also seen in cervicitis, which is the inflammation of the cervix that happens as a result of infection of the cervix. This pinkish reddish discharge can also happen in between your periods. Doctors will refer to this kind of bleeding as intermenstrual bleeding, or quite simply spotting. There's several reasons why you may be bleeding in between your periods. The first is it could be a sign of early pregnancy. Did you know that? Yes, bleeding in between your periods can be a sign of implantation of the embryo. So if you have had unprotected sex, if the condom broke, or even if you missed that pill, oops. And for those of you who are actively trying, seeing this spotting in between your period can be good news. So if that's you, whatever the reason might be, if you experience bleeding in between your periods, Dr. Kady would say, get a quick pregnancy test. You might be pregnant. Another reason why you might be spotting in between your periods is you may have an STD. Once you've ruled out a pregnancy by having had a negative pregnancy test, make sure you're going for an STD screen if you are spotting in between your period and it continues to happen. If you are on a combined oral contraceptive pill, if you have missed a pill because you have forgotten or whatever the reason might be, it will cause an imbalance in your hormones and it will cause you to bleed sooner than you expect to be bleeding. So that's the spotting and pinkish discharge that happens in women who are still in their reproductive years. What happens if you have gone through the menopause and all of a sudden you are experiencing this pinkish reddish discharge in your underwear and you've not had a period for over a year? What should you do? What should you think? What's going on? So for my postmenopausal ladies who experience this type of pinkish discharge or reddish discharge or a full-on period or bleeding after you've gone through the menopause, and remember, the menopause is officially defined as a full year without a period. So this kind of bleeding is probably not sinister or nothing much to worry about if you are in the perimenopausal stage. So this is when your periods tend to be irregular, heavy, lasting longer. You are, getting older and you are bleeding for more than, your normal amount of days for your period, and then you go 3, 4, 5 months without a period, and then you get another one, and that can continue for many years. But as soon as you've not had a period for a full 12 months, you are officially menopausal. So if you get this bleeding or this kind of discharge after that stage, we worry about endometrial cancer. So I mentioned earlier that bleeding after sex can be a sign of endometrial cancer. Yes, that's true, but endometrial cancer is of a greater worry. So bleeding after the menopause is more of a tangible sign of endometrial cancer. So what you must do as a woman who experiences bleeding after the menopause is immediately present to your doctor. Do not wait for it to happen the second time, or possibly the third time, or possibly the fourth time. I would argue the very first time you experience bleeding after the menopause should be the day that you make an appointment to see your doctor. What will need to happen is that you will need to see a gynecologist that will need to carry out a hysteroscopy, which is basically a camera that is put inside your uterine cavity, and a small sample will be taken through a pipelle and looked at under the microscope to identify any precancerous or cancerous cells. Finally, another time when you can see this pinkish, reddish discharge in your underwear is if you are already pregnant. So in this scenario, you know that you are pregnant and you start to see this kind of discharge. Most women naturally know to get checked out by a doctor, because we know that it can go one of two ways. Either it stops quite early and you don't experience any further bleeding or any more of this kind of discharge, or it can become worse and you can actually bleed and pass clots. And obviously, when that happens, we worry about a miscarriage. So if you are already pregnant and you are getting this kind of discharge, it should be a cue. And you don't know whether you're going to continue to bleed, or it's going to stay as quite light and subtle, or it's going to get worse. You don't know what way it's going to go. If you're further on in your pregnancy, seeing this kind of discharge should make you think, are you going into early labor? Or it could also be a sign of infection. So either way, whether it's earlier on in your pregnancy or middle of the pregnancy or later on in a pregnancy, either way, you're going to want to present to a doctor to have an ultrasound scan done. And if it's around the middle of your pregnancy, or even towards the end of your pregnancy, we're going to want to be doing further tests, making sure that there is no infection that can track up and affect the baby. That's all that I have for you ladies in this episode. Remember to share. I truly hope it's been helpful. And remember, if it has been helpful and you have enjoyed it and you hope to see more of this content, remember to subscribe and to share so that we can grow this HeyDoc community, and that this kind of video and so that we can make more of this video to help you ladies out. And thank you so much for watching, and I look forward to seeing you in our next video. Take care.